Welcome to Connect. I'm Sio Hernandez, and on today's program, we're talking about how legal issues can become health issues, and how attorneys can even help cure some of our medical problems. We'll also talk to a nurse who cares for our children when they're in out-of-home placements or foster care. We start by introducing the Medical-Legal Partnership. Paul Cohen, Executive Director of Legal Aid of Marin, and Dr. Alicia Susky, pediatrician for Marin Community Clinics, talk to us about this life-altering partnership and how it's changing communities one patient at a time.
My name is Alicia Susky. I'm a pediatrician here at the Novato office of Marin Community Clinics.
My name's Paul Cohen. I'm the Executive Director of Legal Aid of Marin.
The Marin Medical-Legal Partnership is a partnership between the Marin Community Clinics and Marin Legal Aid.
It's about providing access to justice to individuals who have health needs, regardless of what that health need might be.
It's based on a model that was started in Boston several years ago.
And there was a doctor and a group of lawyers who got together and said, you know, wouldn't it be great if doctors didn't have to write the letter to the employer, to the landlord or to an employer explaining what was going on with the health situation that they had. It would be much better if there was an attorney who was available to provide that kind of service.
The basic idea is that you bring lawyers into a medical practice to address these social determinants of health, which are the non-biological things that affect a person's health. For example, poverty, food insecurity, housing insecurity. All of those issues that we know have a very tangible effect on a patient's health.
A typical situation might be the child with asthma, and basically the asthma is never going to go away no matter how much medication the doctor prescribes. But if a legal intervention takes place and we actually get the landlord to either clean up the mold or whatever's causing the asthma in the apartment in which they live, or we actually help them get their security deposit back so they can move on to a healthier apartment, that asthma is going to clear up. And that's the kind of impact that the Medical-Legal Partnership is capable of.
The National Medical Legal Project likes to say that not all diseases have a biological cure. If you live in a community where you don't have access to healthy foods, let's say you don't have a car and your supermarket is the local 7-Eleven that may stock a few bananas, but other than that maybe doesn't have sufficient, fruits, vegetables, things that would be a healthy snack to offer to your family. So that's a social determinant of health. Your environment doesn't allow you to buy the food that might be most healthy for you. In exchange for not having access to healthy foods, then you become food insecure, which is a significant stress.
Inability to pay the rent, the stress of a foreclosure, the inability to figure out what your next step is when you're now suddenly unemployed. I mean, all of these things are non-biological issues and they all have an impact on health.
There's really three core components to the partnership itself. The first is direct services to my patients, the lawyer's client. The second is education of the healthcare professionals and all of our staff as to how to recognize factors contributing to our patient's health that may have a legal remedy. And the third is a joint advocacy effort between Marin Community Clinics and Legal Aid of Marin to go about doing systemic advocacy. So issues that we see repeatedly affecting our patients, how can we go out into the community and change the root of that problem and not have to do it on a person-by-person level?
We have the Marin Community Clinic relationship, Novato and San Rafael. We are also going out to the Coastal Health Alliance, which is in a collaboration with the Marin Community Clinics out in Point Reyes and Bolinas, where we also have office hours. And now we're working on the Marin City Health and Wellness Clinic so that we actually have office hours there, and we're hopeful that we'll be there very soon.
Thank you, Paul and Alicia. You can already see the huge impact this is making on our communities in such a short time. And now we hear from Pam Dorr, Senior Public Health Nurse from Children and Family Services. She ensures that our children receive medical care when their families aren't able to do it themselves.
I'm Pamela Dorr. I'm a Senior Public Health Nurse bilingual here in Children and Family Services. Children and Family Services used to be known as Child Protective Services, so we are here in the community to provide protection for children in cases of abuse or neglect. The social workers decided a few years ago that because we're providing services for families and trying to strengthen families, they changed the name to Children and Family Services. My primary focus is on the medical needs of the kids. I get involved with the medical needs on what we call the front end, the emergency response end, where they go out and do investigations. If it's health related, I'll get involved or help out the social workers. Once the children are placed in foster care, my primary job is to ensure that the kids get their health needs met. They need to get a physical exam and a dental exam within 30 days. Frequently, these are children who have not had regular ongoing medical care. They usually don't have a medical home where they're seen by a primary care pediatrician. They may have had sporadic care at an ER here, a clinic here, so there's no cohesive medical records or medical history. I try and obtain all the medical records wherever they are and put it together as a medical history to create what we call a health and education passport. The foster parents are at a huge disadvantage when they first get these kids. They'll call me, "I've got this new baby. Do you know anything about this baby? I don't even have the birth date, I don't have the Medi-Cal number, I've got to go to the doctor, what should I say?" So that's when it's so important that we be able to track down the birth history, where they've been seen, if they've been seen, all this information. Otherwise, they're dealing with a complete unknown. If you don't get regular care, we go to our physician and they know our health history, they know our background, they know what we've had before, so they know kind of what to anticipate when we go in with any kind of illness. If a child is not going to the same pediatrician each time, they don't have that history, they don't know their background, they don't know their birth history, all of which are really important when you're looking at a child in terms of making diagnoses. So if they show up at an ER with symptoms, the physicians treat those symptoms, but they won't know the histories. So if they go ER to ER or clinic to clinic, nobody has a good handle on these children if they've been referred to cardiologists, if they've been referred to ophthalmologists, what referrals they've had, what referrals they've made, so what their needs actually are. So a child with a complex heart condition, if they're not followed regularly, nobody knows if they're being treated. We want children to be able to reach their full potential. And those first 3 years can impact the rest of their life. The brain doesn't grow fully, maybe they would have been a scientist or a physician, and they're not going to have that capability now. Maybe they would have been an artist, they won't have the capability if that's not encouraged. So we want to encourage children just to be what they can in the future. If they're not fed sufficiently, if they're not getting enough oxygen because their lungs aren't working, there's so many different things that can impact it in addition to parenting.
Thank you, Pam, for keeping our children healthy. And thank you for watching Connect. I'm Sio Hernandez, reminding you to listen with all your senses, know your communities, and connect.